Hi, everybody. It's Terry Cook with Aortic Hope, filling in today for Karen, Tammy, Molly, whoever usually does this. I'm filling in. Looking forward to it and telling you all about our weekend review. Make sure before you do anything, like and subscribe to our AHTV channel. So let's get started. Monday, of course, is our Medical Monday. It's Medical Monday. Happy Monday. Today's Medical Monday is about transesophageal, I'm not going to say these words right, echocardiography, TEE. What is a TEE? A TEE is a diagnostic test that uses sound waves to create detailed images of the heart from within the esophagus. During this procedure, a small ultrasound probe is advanced through the patient's throat into the esophagus. This is done because the esophagus lies behind the heart. A TEE allows the ultrasound to bypass the rib cage and lungs, therefore, an unobstructed image is created. Usually, physicians order a TEE in suspected valve or aortic disease cases. And below, you can see what a TEE is and the patient going through it. Why is a TEE important in aortic disease? Visualization. A TEE provides unobstructed images of the aortic arch and descending thoracic aorta. Detection. A TEE is especially useful in the detection of aortic dissection. Physicians can see blood flow and tear location by using this diagnostic test. Assessment pre and post surgery. A TEE is used before and during surgical operation. Preoperatively, it's used to understand the unique structure of the patient's aorta. Intraoperatively, it allows for a quick, real-time imaging to assess surgical treatment's success. Valve function evaluation. A TEE can be used to assess function in cases of suspected aortic valve dysfunction caused by aortic disease. Monitoring. A TEE can be used during aortic stent procedures to ensure proper positioning or adjustment of the stent. Its ability to provide real-time imaging is very useful during this procedure. Here's an image of TE. Here's a TE image of an ascending aortic dissection. Are there any risks? The risk of serious problems is low, even though a TEE is considered an invasive procedure. TEE only requires local anesthesia, which consists of a numbing, pain relieving spray applied to the back of the throat. Additionally, medication is given through IV for relaxation. Some patients have a sore throat after a TEE, but this usually resolves within a few days or even hours. Although very unlikely, complications such as allergic reactions, aspiration pneumonia, arrhythmias, or minor I cannot pronounce this word, bleeding can occur. Always remember to talk to your doctor about any risks or concerns. That wraps up this week's Medical Monday. Make sure to join us again in 2 more weeks for the next Medical Monday blog post. Have a great weekend and think aorta. Samantha. She writes our medical posts, so that's why I can't say the correct words. And just, yeah, there you go. You got it. And just so you know, I actually have had a TEE and it is very minor. And they did it so that they could determine whether or not there was a blood clot before they did an actual procedure. So it's not difficult at all. It's actually very helpful. So next, um, it wasn't very long at all. I mean, the relaxation medication, I was definitely asleep. I think it was probably done in 15 minutes. And if in the time I was in AFib, so they wanted to get me back into into sinus rhythm, so that's why they did it. So it really was not bad at all. I would rather do that any day than other things, that's for sure. So then we're on to It's Topic Tuesday. Now, these are the answers to last week's questions. So I'll go ahead and read them through. But if you wrote down the answers or wrote down what you thought was the right answer, you can definitely compare for this week. So Tuesday, if an aortic dissection involves the ascending aorta, it is called a type A aortic dissection. Type A aortic dissection involves the ascending aorta, regardless of the site of the primary tear. Type B aortic dissection involves only the descending aorta. A weakening in a large artery is called an aneurysm. An aneurysm is a bulging, weakened area in the wall of a blood vessel, often artery, resulting in an abnormal widening or ballooning greater than 50% of the vessel's normal width. Aortic stenosis refers to an aortic valve is too tight. Aortic stenosis is the abnormal narrowing of the aortic valve, which restricts the flow of blood from the left ventricle into the aorta and around the rest of the body. Can you tell this was written also by a doctor? A bicuspid aortic valve has two leaflets instead of three. Bicuspid aortic valve is a heart problem present at birth. Bicuspid valve could cause severe aortic stenosis or severe aortic regurgitation. True or false? The only type of surgeons that treat aortic aneurysms are vascular surgeons. Obviously, this is false. Cardiac surgeons who have an expertise in aortic surgery can also treat aortic aneurysms. Which valve separates the left ventricle heart from the aorta? It's the aortic valve. I did not know that. The aortic valve is between the lower left heart chamber and the body's main artery called the aorta. Flaps of tissue on the valve open and close with each heartbeat. They make sure blood flows in the correct direction. Name name two imaging modalities that can be used to diagnose aortic aneurysms. Obviously, an echocardiogram and a CT scan. The echocardiogram is an ultrasound. It's the most common test to use to diagnose abdominal aortic aneurysms. Sound waves are used to show how flows through the structures. CAT scan or CT scan. It uses X-rays to create cross-sectional images of the structures inside the chest. It can create clear images of the aorta. This test also can detect the size and shape of an aneurysm. Again, true or false. MRI machines require contrast dye. MRI studies can be done without contrast dye, so it is false. You can have both. What are the three cross-segment sections of the aorta? The ascending aorta, the aortic arch, and the descending aorta. Here's a bonus. What year was Aortic Hope founded? In 2016, Aortic Hope was founded, and we have provided support to individuals within the community, and we are still growing. This is what we have for you today, folks. We hope you have a great, wonderful rest of your week. Best Duke, think aorta. What's interesting about this is if you go back up, I've had a type A, a type B, and everything that it says in here, I've had echocardiograms, CAT scans. So you can have everything, but as long as you have a cardiac surgeon or a vascular surgeon, they can watch you and make sure that everything is where it should be, the size that it should be, and if you need an operation. Best to always refer to your doctors. Do we have any questions yet or any
No,
chats?
but I forgot to say hi to Velda. Hi, Velda.
Hi, Velda. All right, so let's go on to Thursday. Most of you may know that May is Mental Health Awareness Month. Mental Health Awareness Month. So for today's excuse me, that's a mouthful. May is Mental Health Awareness Month. So for today's Therapeutic Thursday, let's talk about anxiety. Anxiety may play a role in your life as an aortic patient or as a caregiver. Here are a few easy tips to combat anxiety. Challenge negative thoughts. Question the validity of these anxious thoughts. Practice deep breathing. Inhale for 4 counts, exhale for 4 counts. Use aromatherapy. Try calming scents like lavender or chamomile. For me, any scents work. As long as it smells good, it's definitely going to be relaxing. Exercise. Move to reduce stress and boost your mood. Make sure it is approved by your doctor. We also have grounding techniques. You can journal or use the 333 rule to stay present. The 333 rule involves naming three things you can see, three sounds you can hear, and interacting with three things that you can touch. Writing down your anxious thoughts can make them less daunting and help you understand your emotions in the moment. Remember, professional help is essential if anxiety affects your daily life. You are not alone. And that is so true. I remember years ago, I decided to seek out a therapist. And I was put on medication for anxiety and depression. And they told me that and this was probably 10 years ago, they told me over 50% of people were on some type of depression or anxiety medication. So you're not alone in this at all.
I like
And
the idea that people will seek out these medications and get through hard times. And the
it,
stigma of mental health in the country is very weird. It's
it
very
is.
strange to me. I mean,
It is.
like just on the outset of how much we produce as people now versus just 30 years ago with the internet. We work harder, we work longer, we work faster, we produce thousands upon thousands percent more content, and whatever it is that you're doing, you're able to do it faster with people all over the world. And to think that that doesn't come with anxiety. I mean, when you were
Correct.
just working in a small group of people, you kind of knew everybody.
Correct. Correct.
Now it's, oh, this work might be seen by anyone. Great.
Correct. So true. So true. But it is a very good point when you said that mental health is there's a stigma, and the insurance companies and everybody, they need to take it more seriously and understand that more people are affected by this than you really think. And the other thing they always say is that you may not know what's going on inside someone, so always smile. It's the truth, because you don't know.
Agreed.
Any comments? Thoughts?
Well, Velda's having a weird issue. The play button keeps pausing, so her stream is getting interrupted, which is weird. We're not
That
getting
is
any
weird.
drops, yeah.
Okay. Well, we'll just we'll move right on to Friday. The best news ever. Our aortic patient guide is now in Spanish. I'm not going to read any of the screen because I don't speak Spanish, but it is in Spanish. And if you know anyone that needs it in Spanish copy, please let the doctors know. They can apply for a bulk order. We can download it. We can send individual orders. But this was a huge undertaking, as always. And we're so happy to offer it in another language because there are patients, caregivers, survivors all over the world. And I saw that last weekend when I was in New York for the Think Aorta, manning the Think Aorta table. It was a aortic annual or Aortic Association of Thoracic Surgeons, and there were doctors from all over the world. I talked to a doctor in Belgium, many in the UK, one in Scotland, China, Brazil. It was just amazing. So if we can get it out in more languages, even better. But again, if you know someone that needs it, let us know as soon as possible. We'll get you a Spanish version. Then we're on to Saturday. Saturday is always our Survivors Series Saturday, unless we have something else really, really important. So for the Survivor Series, we want to hear from you. On certain Saturdays during the month, we share the stories from survivors. So you can log onto our website, click on the Survivor Series, and someone will be in touch with you. You can do a live, you can do taped, or you can do even a written blog. The more we share, the more people know about us. And then the last on Sunday is the John Ritter Research Program for Genetic Testing. One of the things that's very helpful for aortic patients is to get genetic testing. There are a lot of genes that we may not or may not have been discovered yet that can be tested, can be looked at, and the more people that have them, they may be able to find the doctors in science may be able to find more genes. You can say that doctors and scientists have only identified about 20% of the genes that cause aortic aneurysms and acute aortic dissections to be inherited in families. Furthermore, studies are just beginning to look at the role of genetics in patients who have had an aortic dissection but do not have a family history. These research studies aim to learn more about the genes that cause people to have aortic aneurysms and acute aortic dissections. Further identification of the genes that cause people to have these conditions will increase our ability to identify who is at risk and provide information on how to better diagnose and manage aortic and vascular diseases. To learn more about the program and the ongoing studies, contact a genetic counselor at jrrp.research@uth.tmc.edu. Also, you can go to our website, Aortic Hope, for more information. So that is our week in review. Does anyone have any questions? Are there any comments?
Uh,
Anything else going on?
let's welcome Donna Mobley to the chat. She says, question, have you heard of an ascending aortic aneurysm getting smaller?
No. Aneurysms do not get, unfortunately, aneurysms do not get smaller.
Now, in the support groups, I have heard of conflicting numbers coming in where one number was shorter than the other. And it turns out that that depends on where they're making their measurements from.
That
And
is
so
correct.
you might have an issue where you have a new imaging specialist giving you a different number than the original imaging specialist. And I want to say that it is in like our best interest to tell you to make sure that a thoracic aortic surgeon is the one that is giving you the definitive answer on your measurements.
You are correct. Yeah, the
Yeah.
measurements, we've seen them. I've seen them all the time, or I've heard that the measurements are different. But we wish aortic aneurysms could shrink. It would solve a lot of problems for us, that's for sure. We have some upcoming events. They're on the screen. Our support meetings. We have the caregivers group. We have Rob and Mindy if you
Oh,
want to
oh,
hang
you
out.
got to scroll down a little bit.
Oh, sorry. There you go.
Yeah, bring it
Oh
down to
yeah.
the fifth.
I don't know what day it is.
There you go.
Today's Monday the 6th. Today's Monday the 6th. So there you go. Our support groups, our hangouts, Qigong, which is really amazing. And Qigong is so good, especially if it's most of the time it's in a seating position. So you don't, it's not strenuous, it helps your body. I would definitely try to log on and look at the Qigong when Kevin's doing it. The other thing we have coming up is a live with Dr. Stacy Fisher. She is a cardiologist for several people in the group. Karen's cardiologist, Tammy's cardiologist. So definitely try to log on next Monday for her live. So we are looking forward to it. And is there anything else?
Well, we have a follow up here. So Donna says, I was diagnosed with
Excuse me.
one at 4.1 with no symptoms. And now I have symptoms of a heart attack and had a CT scan, and it came back at 3.6.
Mm.
Right?
Yeah, I can't answer that
She
because
says, I will
obviously we're
talk
not
to my heart doctor.
absolutely we can't
Yeah.
answer that because we're not medical. But I'm sorry that you're having symptoms. If there's anything we can help explain or walk you through, we'll be glad to do that. But definitely talk to your doctor for the different sizes. And again, it could be who's reading it, how they're measuring it. We're talking about medical technology and looking at a screen. I'm always in awe of the radiologists because they can find any organ in your body and they know what they're looking at. To me, it's just a fuzzy black and white screen.
Yeah.
I don't know. I don't know how they
I
did it.
want to say that next Monday, um, Dr. Fisher is going to give us a tour through Karen's aorta.
Is she really?
I think so.
Oh, we will definitely have to find out.
Like
That'll be
when
really fun if she
she
does.
transferred over to the to Johns Hopkins, it
Hmm.
apparently also came with 3D imaging and printing. And so
Wow.
now the surgeons can have in hand an idea of what they're going to be repairing.
That would be so awesome.
Yeah.
The technology is amazing, and it just keeps going on and on. And hopefully, the more we get out there, think aorta, aortic hope. The more that we can get out there, the bigger we are, and the bigger or the more people think about this and know. So you don't get home and get undiagnosed and then possibly not make it. It's
Yeah.
think aorta is the biggest thing.
That is worst
It
case
definitely is.
scenario. I
Hmm.
this last Friday was the Rock from the Heart Symposium for Aortic Health,
Yes.
right? And
Yes.
they threw a kind of a tribute to Nathan. I can't remember his
Hmm.
last name.
I saw that.
16-year-old. That is
Hmm.
heartbreaking. And
It
that
is.
mother, I had to listen to her give her speech and record that, and then get a bunch of pictures and put that together. And I mean, it's hard to work when you're crying. It's
Oh,
hard,
yes, it is.
right?
It's
And
very hard.
so live during that speech, our very special Diane Bishop gets up there, and it is the worst time for her to try to make a speech because she's barely holding on.
Oh
Right, and then
gosh.
so she gets through her part, and then the next the MC comes up, and then he is also still in the throes
Oh,
of it all. And I was like, okay, so perhaps this isn't the best time, and I'll have to chat with Amy and see if we can reschedule when that happens.
that's
Perhaps
definitely,
right before the
definitely.
break.
Yeah. Yeah, I can't imagine.
Yeah.
I mean, losing a child is terrible. And then
Yeah.
to lose a child to something like this,
Yeah.
it's
No
just,
symptoms,
it's
no
horrible.
nothing.
It is.
Just
And yeah, and I can say there was one of the slides we were talking about, not one of the slides, but one of the days of this week, they were talking about hereditary, it being hereditary. And again, that's why you need to think family, think aorta.
mm-hmm.
I didn't know that it was actually because my dad had two undiagnosed dissections.
Oh wow.
If I would have known that, maybe I could have prevented my dissections. But now, of course, I have my son checked and tested so that we know ahead of
Yeah.
time, God forbid something
Think aorta,
happens.
think family. Right
Family.
on.
Yep. Absolutely. Absolutely.
All right, you want to wish these people a great week?
I sure do. And I know I don't want to apologize, but with me having to fill in today, we had to do it at 1 o'clock due to time constraints. I do work full time, so that kind of threw it. So I know 1 o'clock may be a little difficult for people, but at least it'll be out there. You can go to our YouTube channel, make sure you like and subscribe, and we will see you all next week. And I think we'll actually be back to Karen next week. So hope you have a great week. Talk to you all soon. Bye.